Hello, everyone. Welcome to One Tech World. Thank you for being here today. My name is Awele Nwaokolo, and I am a Senior Information Analyst with the NHS in the UK. And I am also a Tech Women 100 Award winner for 2025. And today I'll be speaking to you on the topic, what healthcare teaches us about the future of tech culture. And this isn't just about medical technology. This is basically about lessons from the healthcare sector, about lessons about empathy, about responsibility, and about creating human-centered designs in tech. Now, healthcare is an environment where the stakes are usually very human. We always have urgent timelines, and the impact of the decisions that we make are always felt immediately. And it is one of the clearest blueprints for what the future of tech culture, what it needs to look like. Now, this is about culture. We're talking about culture, about people, and about what happens when we design systems that either forget or remembers the human being on the other side of technology. The internal culture of an organization, what it values, what it tolerates, or what it prioritizes, always shows up on the systems that we build. The internal culture in an organization, everything that we do, the values, it shows up in the system that it builds. Now, I'll tell you a little story about how I came about this topic. Now, I work in community, right, as the analyst supporting community services. And what that simply means is that I am working with teams who care for people outside hospital walls, in their homes, in their communities, basically in their real lives. We have a number of services. We have things like physiotherapy, podiatry, palliative care, pediatric services. And sometimes many of the patients might be people that are vulnerable, or they might be people that are maybe in the final stages of their life. And working in community just made me see my work differently. And one of the things that I worked on that really impacted on or really influenced my thoughts is when I worked on end of life data. So end of life data, basically, for patients that maybe they've been told that they have a few months to live or a few years to live, they've probably been told that they have this time left, and they're given the option to choose where they want to die or where they prefer to receive their care, their final care. So it's our responsibility to ensure that those needs, those final needs of those patients are met. So it's some of the metrics that we measure. So I work on end of life data, just making sure that that the people that go under our care, how many people, for example, that died in their preferred place of death, how many people were cared for in their preferred place of care. Those are some of the metrics that I work on, and I measure the performance. So working on this data just it changed the way I think and the way I see my job, because sometimes in my role, I can be overwhelmed with the technical aspect of my job. Now, sometimes in my role, I do SQL, I work with SQL, I work with Power BI, I build Excel reports and things like that. And I'm running scripts, I'm measuring performance, I'm building capacity and demand models, and I learned to step out from the technical aspect of my job and understand that my my work or the data that I work on is not just data. Every single row in my spreadsheets represents a real person. So I learned to see my work from the human aspect of things. So it influenced the way I do my job. I'm ensuring data accuracy, for example. I'm doing quality checks. I'm making sure that my results are accurate, because at the end of the day, my results has an impact on somebody's life. I just have it at the back of my mind. So there's no room for mistakes. So I make sure that I'm presenting my reports in accuracy. So that's one thing that I feel like we need to do within tech. Now, why do we even need to talk about tech culture? Why does it matter now? Technology is shaping our daily lives. Every single thing that we do is impacted by technology one way or the other. In the healthcare sector, in the financial sector, everywhere, technology is impacting lives. It influences our decisions on who gets access to services. It's influencing how decisions are made and whose voices are heard. And at the same time, we're in a time where we're having a trust crisis. People are asking questions about safety. People want to be sure that technology is respecting humanity, not just their data, you know? So it's important we have this conversation. And what healthcare has taught me is that culture defines outcomes. Now, sometimes there are situations where tech forgets humanity, and the impact is usually really, really costly. Some of you might have seen some reports now. We're having situations like maybe in ChatGPT where people are now self-harming, they're committing suicide. And that's because we are focusing so much on deploying technology before having conversations about norms, before talking about safeguards, before talking about responsibilities, ethics, before we fully understand all these things. Now, conversational AI is becoming a problem in as much as it is also improving lives, is also becoming a danger to people. And this is a very familiar pattern in technology. We are just more particular about speed over empathy. We want features. We get excited by features, but looking at innovation, but we're not having conversations, so much conversations about responsibility. Our systems are often built for capability rather than for care. And when technology enters human vulnerability without cultural readiness, trust erodes quickly. When things go wrong, people no longer trust systems. So that's why we should look at things from the human angle. And this is a lesson that we have to learn from healthcare. Now, healthcare does not have the luxury of failure. Healthcare doesn't have the luxury of failure. When every decision has consequences, whether it's a missing detail or a dashboard that's not reflecting true the accurate results, it might be impacting somebody's life. Safety is not something that we trivialize in healthcare. It is not just a feature, it is a daily practice. We are always big on talking about values, dignity. We're talking about vulnerability. We use humanity as a guide for every choice that we make in the healthcare sector. And that's why healthcare is such a powerful teacher for tech culture. It shows us what responsibility looks like when there's nowhere to hide. Now, in the healthcare sector, there are some major lessons that we apply in healthcare that helps us to create safe and inclusive spaces for everyone. And one of it is that we need to understand that empathy is a design skill. So when we're building new systems or we're building new software for our healthcare sector, we always pay attention. Empathy is our daily mantra. It shapes how we do things, how we make decisions. We always have empathy at the back of our minds when we do our things. It guides us. We understand context lives in lived experience. We understand that's why we encourage listening to people. We have everybody's opinion counts. Everyone is valued, because at the end of the day, we have to make sure that we're bringing everybody together to ensure a safe environment for all, to ensure that people are getting good outcomes of their care. We're listening to everybody. We bring the patients. We ask them how the things that we introduce to them, how it's affecting their lives. We speak to families. We have those kind of conversations. So that's something that we should do a lot more in technology. When we're deploying new software or we're bringing new workflow or whatever, do we go ahead and make sure that the users are constantly engaged? Do we speak to vulnerable people, for example? Do we have those conversations? Do we bring researchers? Do we talk to the users, the developers, everyone at the end of the day? And then a question that we always ask in the healthcare sector is, before we launch anything, who could this harm? Before the designs are created for healthcare, that question is always at the front of it all. Before designs, We don't just make assumptions, who could this harm? That's a question we ask. And that's something we need to do in tech. We need to be asking those questions. And we also have to center our tech, center the vulnerable, ensure that it's inclusive for everybody, put the vulnerable people at the center of it all. Now, if your technology is good for vulnerable people, it is most likely good for everybody else. So that's why those kind of people, it should be inclusive. We should bring in different people. It has to work with marginalized. We shouldn't marginalize people when we're creating technology. We should make sure that we're centering the vulnerable. Another lesson from healthcare is ensuring that multidisciplinary collaboration is not optional. Now, in the healthcare sector, we always bring teams together. So say, for example, I'm carrying out my work, I'm doing my analytical job, using my analytical skills, my technical skills. I just don't work solo. I work with other teams. I get in the clinicians, I ask them, I have meetings with them, I ask them how the things that I create, my results, how it affects them. They are the frontline staff. They are the ones that see this patient. They're the ones that know how it affects them. So the clinicians bring frontline insights. The analysts, like me, for example, well, the ones that bring the pattern recognition, we bring the insight, we're creating the insights, we bring everybody together. When I'm doing my job, I would have to engage, for example, the information governance team that know more about ethics and how data privacy and all of that. So that's something we do a lot in healthcare. And then we constantly engage the patients. That's why we have different kinds of assessments. For example, I've seen, since I've been working in healthcare, I've seen different kinds of assessments. We have things like patient-reported outcome measures. We have assessment scores. We are constantly making sure that the patients are considered first. Whatever, they are the center of it all. We're considering the human side of things. And another lesson we have to also learn from the healthcare sector is that AI and data are responsibilities to people. In healthcare, data is treated as responsibility, not just as an asset. So we always ask for consent. For example, when we're using patient data for anything, patients must know. We must ensure transparency and accountability. That's why we have the GDPR principles, we have the Caldecott principles, data privacy. We are always using those things constantly as we carry out our jobs, because there is no room for failure at all. Data is our responsibilities to people. We have to make sure we're protecting their data. When we're using their data, they need to know how their data is being used. And that's something that we should do in healthcare. That's a culture that we need to learn in healthcare, making sure that we are putting things like that, where we have that responsibility to people. Even when we have algorithms, we're building algorithms, we should ensure that there are no biases. And if we notice that there are biases, they should be addressed even before deployments. So that's another lesson that we have to learn from the healthcare sector. AI does not remove responsibility, it intensifies it. And working with sensitive data has also reminded me of this. We always ask, what should it do and who might it affect? That's how we work within the healthcare sector. Now, in implementation of or deployment of tech, we can learn the approaches that the healthcare sector takes. Now, when I first started working in healthcare, I always used to wonder why it seemed to me that deployment of new systems or new technology always takes time. At first, I didn't understand it. Now, 3 years working in healthcare, I understand it a lot more, because it is not just about speed. We have to slow down sometimes to ensure that it is inclusive. We have to ensure that we are creating inclusive design. Inclusive designs prevents harm later. When you are making sure that you are putting everybody together, the vulnerable people, what category of people are going to be using your tech, and you're putting everybody together, you're not just rushing, because sometimes we're excited again about features, we want to put it out there, but sometimes we need to just take a back step and think about the human side of things. That's something that we do a lot in healthcare. We also need to ensure that we're building psychological safety. Teams must feel safe to ask questions like, who could this harm? Everybody, since we're considering everybody's opinion, everybody has to feel safe to speak up when something doesn't feel right. And then when we're measuring impacts, we don't just measure growth, we also measure impacts. If we're saying how many people downloaded, maybe we're celebrating success on a new technology that was introduced, and we say, oh, we have 1 million subscribers, or we have 5 million people that have downloaded this app. That's not what we should always be focusing on. We should also focus on asking certain questions like, what lives did it improve? Have we successfully preserved the dignity of people? Have we prevented any form of harm? That's one way we should measure impacts, and this is where analytical roles can drive cultural transformation by shaping what organizations choose to value. So we shouldn't just measure growth, we should also measure impacts. Now, I'm going to end it here by saying that the future of tech culture will not be defined only by speed or scale. We are going to be more intentional in how we design. We are going to pay more attention to care, to responsibility, and to human impacts. These are lessons that we live every day in the healthcare sector. We are going to make sure that we are creating inclusive designs. We are paying attention to safety. Safety is our watchword. When we're creating features or we're including designs, we should always pay attention. We should if we need to do training for people, if we need to have these conversations. Every time I go to conferences now, well, I'm happy now these days, every time there's a lot more conversation on ethics and ethical AI. But some of these conversations, I feel we should have been talking about them a lot more before some new technology was introduced. So the future of technology, now we're having more conversations about AI ethics and things, responsibility. We have that. Now, these are lessons that we have been living in the healthcare sector. And it's the lessons we're living in the healthcare sector. And it's something that tech has to learn from. So we should pay more attention. Tech can learn. We should build cultures whereby every single code, we're not just paying too much attention to code, to software, to algorithms. We understand that behind it all, there is a person that matters. There is a family that should be considered. We should look at it from that perspective. And when we do that, tech becomes safe for all. It becomes inclusive. We have considered everybody. That's how the future of tech should look like. And I'm sure we would have a great future in the technological sector. Thank you all. I'm happy to answer any questions that you might have. Thank you for listening.